Thank you. Good afternoon. Today I'd like to begin my remarks by acknowledging and honoring Bill James, the hereditary chief of the Lummi Nation. Bill was an amazing person that helped the rebirth of tribal community values and art. He has joined our other great leaders of Billy Frank Jr. and Stan Jones Sr. His contributions to the aesthetic values of our state was just absolutely remarkable. And if you read about his life, I think you'd find it a very impressive effort of bringing a new art form back to the state of Washington. Our condolences to Bill's family and to the whole Lummi community and to the Coast Salish tribal nations. We know that we have protests continuing in our state seeking justice and change. And I have had meetings with some of the leaders of those from different communities to talk about how we can continue this advance for social justice. And those are going to continue. We are looking for ideas to make sure that we succeed in pushing the progress of social justice forward and eliminating cases of police brutality. I'm glad to know that these are increasingly successful peaceful protests. And I'd like to really thank the leaders who have been emphasizing that to some success recently. We know that we don't want their peaceful message to have been hijacked by violence. And we think that that seems to be working. We are still, of course, fighting a pandemic. But at this moment of having that pandemic, we are now laying bare the racial injustice that unfortunately continues in our nation, and I'm heartened to see a broadened sector of the public who is willing to fight against that pervasive injustice. I'd also like to thank members of the media of their work. They've been very helpful to the community understanding what is going on, bringing attention to this itself, and we appreciate their work. Sometimes they've been in harm's way to do their jobs. I'm joined today by Secretary of Health John Weisman, and he's going to help me talk about our state efforts of testing, which is very important in what you might think of as our new strategy to defeat this virus. As we reopen our state and move away from the strategy of social distancing, testing is a very important part of the sort of four-part program of testing, contact tracing, isolation, and using masks as something to protect ourselves and our loved ones. I think people know that our early struggle against this virus was very much hampered by lack of testing supplies. Supply constraints, particularly the constraints of not having enough of the testing kits themselves, have been constant. After months of our advocacy for the federal government to use its full powers to expand the production and distribution of these supplies, the administration reluctantly stepped up their efforts in late April. In May, we received about 2/3 of the testing supplies that had been promised by the federal government, and we're still doing the best we can against that backdrop, of course, using our own methods to try to obtain the test kits that are necessary to start the testing process. The good news, our testing capacity has grown. We now have done more than 350,000 tests in our state. But there is much more work to be done to fully contain this virus. And this is where our testing goals come up for this discussion today, because we know that we will have many more people that will need tests as we reopen our businesses and people are able to return to their workplaces and places of study. So today we are announcing a significant broadening of our testing strategy. Previously, the medical advice has been early in this pandemic, if a person has symptoms, to simply stay home. If they were mild, did not necessitate a test. But as more testing supplies have become available, we now have a new strong and emphatic message, and that is, if you think you're sick, please get tested. We strongly encourage people to do this, even if people are mildly symptomatic. This is a shift of strategy. It has been enabled by the fact that we've had more testing supplies to get this work done. We know that testing is critical. As I've indicated, it's the very first step in the four-step process so that we can move our state forward. It also helps measure our county's progress as they move forward through the various phases of our Safe Start effort. So I just want to talk about the folks who we need to get tested. First, if you think you have the symptoms, even mild, of COVID-19, please get tested. Second, if you are a household member of a person who has the suspicion of COVID-19 or has come into contact with someone, please get tested. Third, crucially, this will involve a wide variety of congregate settings of folks who we ask to get tested as well, including those of people where they live and work, where there is infection, and there are congregate settings that call for this action. This includes job sites like meat packing plants, agricultural sites, as well as close low-income housing, long-term care, homeless shelters, and similar situations where the risk of infection is high. Now, here's a really important point in addition to getting testing. While you're waiting for your test results, we need you to stay home until you get a negative test, and that includes people in your household. We can't emphasize enough why this is such an effective way of breaking this transmission, chain of transmission. And the reason for this is that the new science shows how much of this transmission occurs early in the course of the disease. The science now has made clear that much of the transmission can occur before people really even have symptoms. So the need, if you do develop symptoms, to stay home immediately, even before the test results come back, you can really help our community and your families and your loved ones and the people you work with. So we hope that people can do that. Also, a word to our providers, our medical providers. If a patient comes to you and said that they're concerned because they have COVID-like symptoms, we really need you to provide those tests and find a way to get that job done. And we appreciate that. We know that these have been tough decisions for our medical personnel. They've made some good decisions, but now is the time to really ramp up the testing for folks that have these symptoms. Now, we know the symptoms of this illness include cough, fever, or shortness of breath. And that's something to talk to your physician or other medical provider about. You can call your doctor, of course, or find a clinic where they have drive-through or walk-up testing. You can go to coronavirus.wa.gov, that's coronavirus.wa.gov, to learn more about locations and the like. And for the people who are not able to seek regular health care, we're going to be working to get more avenues to get options fulfilled, including home testing options, which are now coming on that have been improved and are more widely available. Now, even where there are no active cases, in the environments where there are no active cases, we'd like to get to the point where we're doing routine screening of high-risk populations so we can catch early warning signs of COVID-19 where it may be spreading. And the ability to reach our most vulnerable and marginalized populations to ensure adequate testing is a bedrock part of our plan. Certainly you know that we've increased our testing regime with our folks in long-term care facilities. That's just one part of our strategy. Now, the supply chain for collection materials is still something that we will be working on, but we do believe that these steps are now the right ones for us to broaden our testing regime. With that, I'd like to turn to Secretary Weisman to tell you some more. John.
Good afternoon, Governor. Thank you for that, and welcome. welcome everyone. I am really pleased to note that with more widespread testing now being available, this can really help people get a peace of mind to know if they're infected with COVID-19 or not if they get a test, help them make sure that they can keep the people around them safe if they are infected, and help us know that the pandemic is getting better or worse here in Washington by getting a test. Now that the testing supplies, as the governor said, are more available, Washington State's testing strategy centers around this. Anyone with symptoms consistent with COVID-19 can and should be tested. Additionally, close contacts to those with confirmed COVID and those in congregate care settings where a positive test has been received really should also be quickly tested. As the governor mentioned, our goal is to get all people who are experiencing symptoms consistent with COVID-19 tested as soon as possible, and ideally within 24 hours of developing symptoms. And that's because, as the governor said, we know that the infectious period of this and the infection rate can really be prevalent at the beginning of the infection, sometimes even before people have symptoms. So it's really important that people quickly go ahead and get in and get tested. Now, this plan, as always, is contingent upon supplies being procured through the state procurement process and the federal government. And as we said, we're pleased that those supplies are starting to come through in a bit more regularity. Equity of all of this work really is our primary focus as well. We know that people with lower incomes, the elderly, people of color, and immigrant and refugee communities are suffering more from the COVID pandemic than are others. These communities do need to be prioritized, and we have to ensure that we are reaching them in culturally and linguistically appropriate ways. We've received questions about the affordability of the test, and we're really pleased that the insurance commissioner has extended his emergency order waiving co-pays and deductibles for anyone requiring a COVID-19 test. This will be in effect until at least July 3rd. Persons on Medicare and Medicaid have their tests fully covered as well, and public health is paying for tests associated with outbreaks or uninsured. And finally, our community health clinics can also provide a test to persons without insurance. In terms of capacity, part of making this strategy successful is increasing how many tests we can process in labs across the state. And as the governor has said, the volume of tests we can process daily in our labs has increased dramatically. Keeping these labs fully supplied with the needed materials to run our tests does remain a priority for us. We will be prioritizing the regional laboratories with the ability to perform and expand their capacity to do high-volume tests with rapid turnaround times and electronic reporting, as this will prove more efficient than utilizing a larger number of smaller labs, and will make sure that the results are received more quickly. Now, the success of this testing strategy will be determined not merely by how many tests are performed, but by ensuring that the right people are tested and that the results, as I said, are available rapidly enough to help prevent further spread of the virus. To ensure that our state strategy is effective, I encourage anyone with symptoms, as the governor said, consistent with COVID-19 to be tested. And again, those symptoms, and we've added some symptoms in here over time, could include fever or chills, cough, shortness of breath or difficulty breathing. Those are the symptoms people have been hearing us talk about for a long time. But they can also include things like fatigue, muscle or body aches, headache, a new loss of taste or smell, sore throat and congestion, nausea or vomiting, and diarrhea. So if those things apply to you, contacting your healthcare provider and seeking a test early is really the thing that we want you to do. And I know we have to kind of undo what we were told or learned here earlier. As the governor said, in the beginning, we basically encouraged people who didn't have chronic diseases, were younger, mild symptoms, to stay home, don't go get a test. And the reason we did that was really twofold. One was there just weren't enough testing supplies available. And secondly, our clinics and others weren't necessarily prepared to handle people safely with the infection control precautions. Those things now are on a much better path. And so we have to now kind of unlearn some of those messages. And so again, I just want to implore anybody who thinks they might have symptoms or they know they were in close contact with someone with COVID, please go get a test. You can learn if you were infected or not, and work to help us prevent other people from becoming infected. And with that, Governor, I'll turn it back over to you.
Thank you very much, John. I'm glad we're making progress. I want to talk about another part of our progress, which is moving some of our counties through our phases. Again, I want to thank Washingtonians. The reason we are able to do this is that so many of our citizens have really helped out in many ways to socially distance, and now we're moving to the new phases. Last night, the state received an application from Garfield County to enter Phase 3, which means we now have 7 pending applications. Also, as of yesterday, Skamania County became eligible to apply for Phase 3, and a 9th County, Whitman, could become eligible Friday. In that process, each business or entity operating in Safe Start Phase 3 needs to develop a written safety plan for how they'll prevent the spread of COVID-19 in their business. And this needs to meet, of course, the minimum protective requirements that have already been laid out by the Department of Labor and Industries. This plan doesn't need to be submitted to a state agency or a county agency, but it does need to be retained by businesses so that we know that people are serious about this and made available for inspection. Businesses can use the template created by the state to draft these plans. They're still required to follow industry-specific guidance that we have provided. I do want to reiterate that the metric goals that we are using are intended to be targets. Not every specific one is a specific line. Where one target may not be fully achieved, actions taken on the other measures could potentially allow a county to move forward. So we're judging this on a totality of the metrics that we're looking at. But I do want to say this is for us to succeed, this is going to require an increase of our efforts, and that may seem counterintuitive. The fact is that people have worked hard going inside for social distancing. We're going to have to work harder actually going outside as we move away from social distancing. And the reason is that blunt instrument was pretty clear. You could just not go to work, and that was clear what worked. Now we're going to have to make a lot more decisions during the day of making sure we do put on that mask when we go to the grocery store and doing what we can to cooperate if there's contact tracing that needs to be done, certainly washing our hands, and otherwise taking care of our health. And so there's going to be millions of individual decisions, and if we make them as Washingtonians, there's a good reason that we're going to stay on top of this virus. But again, I want to ask you to not lose an intense focus on this infection, because it remains virulent, it remains dangerous, and it remains something that we need to keep working on individually. So the same rules we have for Phase 1 apply to a modified Phase 1, which are some applications are now in review by the Department of Health. Lastly, I mentioned yesterday that we're updating our COVID-19 assessment dashboard that can provide more information available to the public for regional and county trends. And there'll be more information talked about tomorrow from our Joint Information Center briefing. Obviously, COVID-19 is not the only challenge we have. We have an upcoming wildfire season. And I want to mention it because we will hope that we can take all of us reasonable measures to reduce the risk of that as well. In a sense, it's kind of like COVID-19. There are things we can do to protect ourselves, to check on burn restrictions, be aware of the wildfire risk status, of course, put out campfires, try to make your habitat fire safe. If we live where there's trees, a lot of things we can do to keep brush away from our houses to help to preserve our homes. You can get more at dnr.wa.gov, dnr.wa.gov. And we think that this might be a more difficult season in part because our firefighters at DNR has estimated it'll take 25% longer to suppress these fires because of the necessary limitations we have dealing with COVID-19 and some of our restrictions. So if we're ever going to be careful, this is going to be a great year to be careful to try to reduce fires. And we want to thank our firefighters during the recent days that have been challenging for all of us. So for that, happy to stand for questions.
First question comes from Rachel with AP.
At the end of April, you said that in order for the state's contact tracing plan to work, daily testing needed to increase to between 20,000 and 30,000 tests a day. We're currently averaging 4,400 tests a day. So with your encouragement today for everyone to have to be tested if they have symptoms, are you saying that we now have enough supplies to conduct that increased level of testing? And is there any new guidance as it relates to antibody testing?
So we have the analytical capability to analyze about 20,000 plus tests a day. We're getting close to having enough test kit supplies to actually get those samples. So we're getting to some healthy numbers in that regard. We feel we're certainly in a position where it makes sense to test everyone, even with mild symptoms. And that is an important threshold, I think. But we do want to continue to build our testing supplies, because as people get back to our congregate settings, we want to make sure that we have rapid testing available. We do in most of that, but we want to be that very convenient. So we're still working to increase the test kit supply system and to make sure that that supply chain is stable. As I've indicated, we had some statements from the federal government that haven't been fully realized, and so we want to make sure we have a stable supply system. We're looking at domestic manufacturers. I had sort of a summit this morning with manufacturing, about a dozen or more companies, to try to increase our manufacturing capability domestically for PPE and testing supplies potentially as well. So what I would say is we've met an important threshold. We still want to continue to build that capacity. As far as the antigen testing, we're continuing to hope that this technology will become usable. There are several companies that we are following and talking to see if that testing can be useful. It needs to be proved out as effective, and those evaluations are continuing. Now, as folks know, it's not the be-all and end-all, even if it shows it's effective, because not only would we have to show that you have this antibody, but that actually gives people immunity, and that science has not been shown yet. So we think these tests can be useful in determining the general spread of the disease, the amount of the community that's been infected. We're confident it can do that if these tests are actually validated. But we don't think the science is anywhere close enough to say that actually would give people immunity that would allow them to, just have, if you would, a passport to be free and be free of the virus for future infection.
Governor Reed would like to add as well.
Yeah, Reed, go ahead.
Can you hear me?
Yeah, go ahead.
Great. So I just wanted to add one brief point to supplement the governor's point about testing availability, and that is that as of yesterday, we've unveiled the successor version to the state's COVID-19 risk assessment dashboard, and we'll be speaking about that a little bit more tomorrow and helping people to navigate it. But this dashboard helps people to look at the testing availability by county, and particularly with a look at two key metrics, one of which is the percentage of individuals testing positive, for which the Department of Health has set the target goal of 2% or below positivity as an indicator both for the course of the disease and also for the rough availability of testing. If your positivity rate is too high, it's likely that you don't actually have the testing system in place to be able to find a lot of cases. And you can see on that dashboard that something like roughly 20 counties right now are meeting that metric.
Thanks, Reed.
Next question comes from Derek with the Seattle Times.
Hi, Governor. Other places that have had large protests this week are asking anyone who attended to get tested for COVID-19, regardless of whether they have symptoms. Why has Washington not urged anyone who's been in protests to get tested? And how is the states like Minnesota and Illinois are equipped to offer that much testing and Washington isn't?
John, you want to talk about that?
So I'm unmuted now. Thanks. Thanks for that question. So obviously, if somebody's concerned and didn't take protection at a protest, they are certainly free to go ahead and talk to the healthcare provider and get a test. That's certainly an individual choice. We are having our folks in local public health who are doing the case investigations, so talk to folks and see if indeed the folks who are testing positive were at any of these large gatherings, and certainly that will help inform any future recommendations we might make. But again, I think reinforcing some of the messages we've given earlier, that is, if you are going to choose to go to one of these larger protests, everything you can do to protect yourself is critically important. Keeping your distance as much as you can, 6 feet ideally from others. Certainly do not go if you are ill, have any kind of symptoms of not feeling well. Encourage, folks to give strong thought about not attending if they're 65 and older, have chronic underlying health conditions, and definitely to wear a face covering if you're there, and take your hand sanitizer along as well. All of those are really critically important. And again, at the moment, we're not sort of recommending generally all those folks go get a test. But again, if somebody wants to, if they're concerned, they didn't take precautions, then certainly they should feel free to contact their healthcare provider.
Great. Next question comes from Drew with King 5.
Good afternoon. A question for both the governor and the secretary. As Rachel pointed out, we're at about 4,400 tests a day. A month ago, we were up in the mid 5,000s. How do we explain this drop in testing? Is it fewer people need to get the test? Are people afraid to get the test? What are we thinking is the reason that we're seeing this drop? In other states, we're seeing an increase.
Well, just one comment. I'll turn to John. I think we're about 6,000 average the last week or two on the particular dates. It is very, we've seen it up. I think yesterday it was over 8,000, I think. At least I think the testing is going to go up for a variety of reasons. One, we're getting more people going back to work in a congregate settings. Two, we're giving people advice now that we now do have capability to test everyone, even with mild symptoms, and that should get the numbers up. And the reason we've been able to do this is we're finally getting some test supplies being able to do this. That has been the limiting factor. So I think you're going to see these numbers go up. But John, you want to talk about that?
I would agree. The numbers have been going up. We encourage people really to go to the dashboard on the website. You do see some days that are lower, and those are the weekend days. The weekend days have always been lower for testing, which is a goal of ours that perhaps we need to have better access on the weekends. But as the governor said, the numbers have been going up. We want to see them go up even further. The other thing that I think is probably working at this point is that the infection rate is probably going down somewhat at this point. We've certainly been seeing that when we look at our county rates and in many counties. And so there are fewer people also, I believe, with symptoms. So all of those things are playing together. But again, we've got the capacity, and so anybody who's got symptoms similar of COVID, we really do want you to go out and get tested.
Okay. Next question comes from Jim with the Spokesman Review.
Governor, I'm wondering how far back you're recommending people go in determining whether they've been in contact with someone who's had COVID-19 and should now be tested. I mean, are you talking a week ago, 2 weeks ago? Because the symptoms don't show up right away, and so there's some confusion, I think, out there as to when might I have been infected with COVID by somebody who's asymptomatic.
Well, I'm going to let John answer that. I have an answer. I'm going to listen to John's, and then I'm going to see how accurate mine is. So, John, why don't you start?
you all were right on the right track. It can take up to 14 days for symptoms to develop. So anybody who was around somebody with symptoms 14 days ago as long, you should go ahead and get tested. That's really the basic time period that we are most concerned about. So it is that 2-week time period that it can take to develop symptoms after exposure.
John wins an award because he totally agrees with the governor on that answer. So glad to be on track with you, John.
Okay. Next question comes from Essex with Cairo.
Yes, Governor, 2 questions for you. Is it reasonable to believe that the Pierce County Sheriff's Office can conduct a truly independent investigation of Tacoma police in the Matt Ellis case? Will you use your authority to order the investigation turned over to a more independent agency? And these protests have been very peaceful in the last 24 hours. Are there any changes in statewide policies that you will seek in response to the protesters' demands?
Yeah, I've talked to, last couple of days, I've talked to any number of people who've been involved in the protests, and I do think they've espoused a desire to make sure that we have independent investigations and as much independence in any prosecutorial decisions as possible. And I do think there's some things that we are considering to give a high degree of confidence about that. Those haven't been cemented yet. My understanding about the situation at the moment is that the investigation has been going on for several weeks by the Sheriff's Department. The police officer in Tacoma was a City of Tacoma police officer. The investigation is being conducted by the Pierce County Sheriff's Department. There may be some things we can do to give another overlay of independence, potentially by some other agency, or potentially by the Attorney Generals. We are considering options about that, and we'll probably have more to say about those in the upcoming days. I do think it is important to give people as much credibility as possible. I think that is vital. As far as changes, look, I hope there's a lot of changes come out of this most recent experience, because we know that this has been a systemic racial pattern in our country for centuries, and we're not done stamping it out in a whole host of ways. And we're now involved in discussions, listening to people about their ideas, certainly when it comes to unnecessarily police violence, but also all of the other manifestations of this problem that have ended up with huge economic inequities, a lack of educational opportunities, disproportionate access to health care, and all the other things that have affected people's lives. And I'm hopeful that we're going to address many of those things in a variety of contexts. And I think that what we need to do is to look for ways to fight those battles in areas where you don't immediately think of them as racial justice issue. I mean, like COVID-19, the fact that we've come up with, I think, good protections for our agricultural workers that have been predominantly Hispanic folks, that is an equity issue. And I'm glad the state of Washington has acted to try to protect people in that, hardworking people in that industry. But it's so pervasive. And that's one of the things I think it's difficult for us to walk in other people's shoes. I was reading an interview with Russell Wilson this morning, talking about he grew up in a, middle class or even upwards sort of social strata when he grew up. But he remembered his dad telling him, look, you got to remember you're a young black man, and you got to keep your hands where they can be seen when you go into a convenience store. And that's something I've never experienced, but he did. And we got to understand that that's the way people of color frequently have to deal with on a daily basis. So I guess my point is, yes, I hope that there will be changes, and we're going to be seeking people's ideas on how to do those things.
Next question comes from Jerry with the Everett Herald.
This question, I think it's probably best for Secretary Weissman. It's regarding the moving from phase 1 to phase 2 for Snohomish County. Their application came in Monday. I know the county health officer and leaders have been in close contact with the state for weeks leading up to that application. I know you're working diligently on it, but Can you tell us what specifically is holding up a decision on that county? What do they need to do, or are you looking for that is preventing you from acting?
Thanks for that. First of all, sort of nothing is holding up any application at this moment. We really got applications in, I think, on maybe late Monday, Tuesday. We put together and trained our teams as part of that. So we are reviewing those. We have a team of 9 right now who are reviewing all the applications that have come in. And at this point, we have something like 12 or 13 applications, both between the phase 1 going to 2 potentially, or some version of that, as well as those from phase 2 to phase 3. Our team is meeting every night to go over the applications that have been reviewed and vetted. If the team does have follow-up questions because of missing information or something that raised a concern, we're following up with the applicants on those and getting the additional information so that we can have a complete review. And tonight will be our first night of being able to review applications that are completely reviewed, and we'll be moving forward from there. So nothing's holding up any of the applications. We know that people are anxious to get their answers. We're moving as quickly as we can and want to be thorough as well while we do that. So appreciate everybody's patience as we complete those reviews.
Next question comes from Austin with Northwest News Network.
Hi, Governor. I wanted to ask you to expand a little bit on the answer to the question I asked yesterday, and that is about the ongoing protests. You may be aware there's a letter circulating, I think nationally, that's been signed now by more than 1,200 public health professionals, infectious disease people, and others, making a distinction between the protests over stay-home orders and the current protests over police violence and racial injustice, and going so far as to say that they, in this letter, that they do not condemn these gatherings as risky for COVID-19 transmission. In fact, they support them as vital to the national public health. And also to, the threatened health specifically of Black people in the United States. Do you also make a distinction like that, and is this a letter you would consider signing on to?
Yeah, I'm not familiar with the letter you're referring to, and I'm not even sure what, in general, that letter is proposing, so I'm just not familiar with it. As I said yesterday, we believe there are some First Amendment rights that we have respected, even though we do understand there have been some increased risks in any large gathering, and we have respected people's rights in that regard, whether they come from the right or the center or the left. And that's the position we've taken. We think that's the right position.
We have time for a few more questions. The next one comes from Jim with the News Tribune.
Governor, you've talked about the inequities in society that people are discussing. Given the condition of the state budget moving forward, is there a way that you and the legislature can deal with that revenue decline without aggravating those inequities? And if so, would that be accomplished solely by tax increases?
Well, I know we would like to have a solution to our fiscal challenges. I can't even pretend to offer that solution right now. We're going to have hundreds of discussions to figure out what that is. I don't think it's probably helpful to try to speculate on that right now. So the answer is all will be revealed when we reach some consensus in the state that can get the votes in the legislature to really solve these multiple problems. And that's really the best I can offer you right now. I know people would be anxious to have a blueprint, but we don't have the latest fiscal suggestion. We don't know where the votes are in the legislature. We don't know who will be in the legislature, next year. So I really can't offer you a lot of guidance on that right now. But I will say that, as I've said now on multiple occasions, I'm hopeful that our review of what we do as a community is much broader than just involving the disproportionate impact of racial injustice on police violence, but looking at it in the whole context of what it means to raise your family in the state of Washington. And we know that there has been a massive economic inequality for decades or centuries in our country, and that is true in Washington State as well. And we should, whatever we do, we should be acutely aware of that and do what we can. It's one of the reasons, and by the way, I'll just for a few moments note that we have done things in this regard. When we came up with the best financial aid package in the United States, that does help reduce racial inequality, because the lower income folks have had a harder time going to college. When we were one of the more successful states increasing access to health care, that does in some degree reduce some of the economic inequality, because there are disproportionate numbers of people of color who've fallen in the bracket of not having health insurance. Our efforts to have full-day kindergarten and to expand early child education, these are things that have some impact to try to reduce the racial disparities eventually that occurs in education. So the state has been on this course, but we know there's so much more to do.
Next question comes from Hannah with Cairo Radio.
Hi, Governor. 2 questions. One, a follow-up from yesterday, where you said regarding I-940 and police accountability that you stressed the importance of ensuring that various aspects of that there was oversight to make sure that they were being implemented. My understanding is the final rulemaking on that did not include that kind of oversight to make sure departments were, in fact, implementing all of what was in I-940. My question is, do you anticipate proposing any legislation or requesting any in the next session to make sure that that happens? And then following up on Austin's question, you know, there were more than 10,000 people gathered in protest in Seattle yesterday. That's been the case for almost a week now. I understand your position on that, but I'm wondering, what would you say to people, family, friends who've stayed away from one another for months, businesses that might close, kids who've lost in-person education, about why they've had to do all that when these protests can continue?
Well, first off, on the 940, I do believe there's more work we need to do to assure that we have proper assessment and independent review anytime there's a police violence incident. Part of that has to do with some of the rulemaking that needs to continue. That may not require a statutory change. It may require simply rulemaking that some of the block and tackling and setting up these standards of how those reviews should be done. So that we might be able to do that without additional statute. But as I indicated in the question about Pierce County, I do think the state needs to give more thought about which investigatory agency should be involved in investigating police violence, and we should have more thought about, I think, prosecutorial decisions. We are having discussions with, and will have with, the broader community about those issues. That may or may not require statutory changes. We might be able to do that simply by agreements between police forces and different investigatory agencies. The way it works right now is generally police departments have agreements with other investigatory agencies to handle investigations when one of their own police are involved in some incident like this. It's worked on just an agreement basis between agencies. We might need to consider something a little more rigorous to assure a geographic distance. That's a possibility. So I think those things are open for discussion, and they may require statute changes. We'll see.
Next question comes from Carolyn with the South Seattle Emerald.
Hi, yes. I do have a couple of questions. The first one is...
By the way, would you excuse me for a moment? I'm really sorry. I didn't answer the second question of the previous questioner. Ask about the protests. Look, given both the First Amendment and the fact that 10,000 people are on the streets at a time, it's not something the state's going to wade into for this purpose. What I would say is that we're just asking people to be as protective of themselves as they can, and certainly wear masks. That does have a beneficial impact to reduce transmission, particularly in your ability when you wear a mask. It reduces the chance you're going to infect someone else. And certainly if you get any symptoms, please follow our advice to get tested as soon as possible and let people around you know, and isolate yourself the moment you get those symptoms. If you do those things, you will reduce the rates of infection. And that's the best answer I can give it depends on people's helping us out here.
Carolyn, you can ask your question.
Great, thank you. So yes, as I mentioned, this first one is for Secretary Weissman. You've mentioned focusing on vulnerable populations, which obviously includes communities of color, specifically Latino and Black communities. However, there are many historical reasons for communities of color, particularly the Black community, not to trust the American medical system. They can also face barriers to testing, including access to reliable transportation, or rather lack of it. What work will you be doing with community groups to address their concerns and help them surmount these barriers?
Great, thanks. So indeed, we understand those barriers and opportunities to make testing as widely available in as many different settings and in culturally and linguistically available sites. So that's part of what this plan is also working on, and working with local communities. We really feel local communities that are trusted entities are the best to both help deliver that message and to provide the services. We're really trying to shift a lot of those services from the hospitals into clinic-based systems and our federally qualified healthcare centers, and making them available in pharmacies and other places, as well as the drive-up sort of drive-in sites. I was just going home the other day, and the Tacoma Dome, for example, had, again, a public test site that can be available to folks. As the governor also mentioned earlier, as more of these testing tools come on board, home testing, for example, where people may not have as great access to transportation or time in between a job if they're on a job at this moment to be able to do home testing. So it's really about having, I think, all of these methods available to people and being able to promote them. So we are looking forward to the time when the home testing is much more, when we have approved tests that are readily available. This is going to require us working closely with communities and working in local communities with their trusted sources, whether that be, for example, tribal health clinics, clinics that provide services to low income, where they already have those relationships with community, where they have providers that look like the community, that speak the language. So continuing to get these tests into clinics that people already have a relationship with their provider is going to be critically important. And we're glad that the supplies are increasing so that we can help get those out to those sites.
Great. And we have time for one more question from Keith with Como.
Governor, this has to do with a phasing question. What is the option of getting people ready to go, and for Secretary Weissman as well? The restaurants need to know if they need to bring on extra staff this weekend. They want to know if they have to plan for tomorrow night. Why can't you tell them sooner than later if they need to be ready to go for restaurants this weekend? And also, for the governor, you have a new set of dials and dashboards for counties. Why not let each county take the ball from here and decide for themselves? Because what happens in Tacoma is not happening out in Eatonville.
Well, the reason is we want to reduce the number of people who get sick and lose their lives in the state of Washington. And the state of Washington has a responsibility to all of our constituents to take reasoned, scientifically based decision-making so that we reduce this pandemic and it doesn't come back and run through our state again. That's the basic reason what we're doing here. I don't want to lose sight on that. This is not some sort of little rhetorical flourish or recreation we're running here. We're trying to get people from dying. And what we're trying to do is to assure and give all Washingtonians confidence that as we reopen our communities, that we will simultaneously do the smart things that will reduce the transmission rates. And that's what we're evaluating in these applications. The reasons these can't happen within nanoseconds is we're not just a rubber stamp. We actually, the Department of Health is evaluating the capacity of the counties to actually do the testing, to actually do the contact tracing, to actually do the isolation and effectively manage to keep this pandemic from coming back. So I think the department's going as fast as humanly possible to actually assess those things. We know that restaurants and everyone else are just chomping at the bit for good reason to reopen. And I can tell you that we are very cognizant of that. That's why people are working so hard to review these applications. But I don't want to diminish the importance of doing this right. Look, if we do this wrong, we might have lost all of the agony we went through the last couple or 3 months. We do not want to do this again. It was way too painful for restaurants and business owners and families. We want to do it right. And doing it right means that we do the smart things to use these new tools that we know work, including, wearing masks. So if we do this right, I think there's a reason to believe we're going to come back real strong relatively quickly. But that's the reason we can't tell people at this exact moment that all of these applications just get the rubber stamp. The state of Washington owes its constituents more than that. There was another kind of embedded question in there, but John, did you want to add anything to my answer?
I think your answer was right on.
Did I answer your question, or did you have another? I sort of sensed there were two questions there. I can't remember what the second one was. Okay, well, we'll call that a day. Are we ready to wrap up here? Just closing comment. Again, thanks everybody. I think we are making real progress. It is a joy to be on the road to recovery, of open up these counties. We've made real substantial progress in the last few days and weeks. The things that are happening now in the last few days are gratifying. And I want to reiterate, the reason we're in a position to be able to do this reopening is because Washingtonians have been diligent and responsible already. And if we continue on that course, we're going to have a really good result in the state of Washington. I want to thank everybody. We know there's all kinds of questions. Somebody asked a question about why are people in the streets protesting, whereas we haven't been to restaurants. That's a legitimate question. The answer in part is because the U.S. Constitution protects free speech and the First Amendment. But people have been willing to accept the difficult decisions we've had to make to try to reduce this pandemic, and I appreciate that. And I hope we will continue in that spirit. With that, please be well, and please wash your hands.